I'm Dr. Vanita Rattan, a medically qualified doctor and a cosmetic formulator specifically for skin of colour. So you may or may not know, but we have launched the world's first facial formulated for skin of colour. It includes microneedling, a chemical peel, a stem cell sheet mask, radiofrequency, and I'm doing the treatment on my face today and I'm taking you on the journey with me. I will explain every single step, how it feels, what it's doing for our skin, so you can see what to expect when you come and get your treatment done. Let's do it.
So now we're going to do the cupping. You're going to get blood flow into the skin, detox the skin. This helps with puffiness. It can help with decongesting the skin as well.
Because it's so relaxing, it reduces your cortisol levels, your stress hormones.
Using the hydrating toner. And I'm using the Glow Serum, our magical serum. This stuff is great. It's Dr. Vanita's secret.
This is such a difficult formula because not only did we have to get the ingredients right, we had to make sure that it conducted radio frequency energy. So it had to do both in order for this facial to work.
Absolutely.
And that was so hard.
I'm going to use the radio frequency now. It's going to feel quite warm, but it's not going to be hot. We need the skin to be warm for the peel to work really well, to keep active and to absorb all the tyrosine inhibitors into the skin. How does it feel?
Really relaxing, warm. For everyone watching, guys, if you feel like nervous about anything, you can just ask the practitioner as you're going along. Like if you feel like something's tingling or feel like something's uncomfortable, you just say it. The practitioner's trained to listen to you because this is for skin of colour. So it's really important that we get feedback from the patient while they're on the bed. So don't be nervous about saying how everything's feeling to your practitioner.
So this hot towel helps us to maintain the temperature we need for our peel. How does it feel, Vanessa?
So nice.
All right, so I'm applying the Glow Peel now. So this stuff is really awesome because other than just getting rid of the top layers of the skin, resurfacing it, which is essential and very, very good for treating hyperpigmentation and dealing with fine lines. It's packed with tyrosine inhibitors, which is brilliant because it helps us to work on the pigmentation that's on your skin right now and prevent further pigmentation coming through. So it's not just a peel.
So guys, what you can feel now, it does have a strong smell. It goes on feels like silk as it's going on and it's starting to tingle. For me, I'm really sensitive. I've got very sensitive skin, especially as I age. So for me, it's starting to tingle on my cheekbones, which I expect because that's the most dry, sensitive part of my face.
How tingly, scale of 1 to 10?
Maybe a 4 out of 10. I know I've got very sensitive skin, so I'm actually a really perfect person to do this on.
So I'm using the Jessica to warm up the skin. We're going to work really quickly. We don't want to get the skin to feel uncomfortable because that is not good. We don't want to prompt any PIH on Vanita's skin.
This is so nice though. Oh, this is so relaxing. Oh, this is amazing.
Right, how did that feel? How's the tingling going?
I'd say a little bit of sensitivity on the cheeks that I normally have anyway.
So I'm just going to apply the hydrating mist again.
So this, guys, is the bit that people are most nervous about. I'm such a baby. I don't know if you guys know. I'm so pathetic. Whenever I go and get my blood's done or an injection, I tell them please treat me like a 6-year-old. Please, I'm so pathetic.
Yeah, my sticker ready.
Yeah, so I'm going to tell you the honest truth of how this feels.
Okay.
Oh, a bit prickly. Interesting.
How does it feel?
Feels like a bit scratchy.
Yeah.
But not painful. I would just say
little prickles.
Yeah, little prickles.
Scale of 1 to 10.
Maybe a 4.
Okay, that's all right.
My skin go nice and pink.
Yep. And as I get closer to the cheekbone, we may feel a little bit more.
It feels so good. It feels like something really good is happening.
It's a little bit more sensitive.
Tiny bit, but that's because it's a bony area. It feels so good. It just feels like I can feel all the blood rushing.
Yes, to your skin.
Yeah, and that's amazing, guys, because you need that in order for fibroblasts to be stimulated.
All right, I'm moving on to your next one. You okay?
So good.
You survived.
It's a bit uncomfortable, but it's so good. I just feel all the good things happening to my face right now. Guys, can you see? I know I'm going to be super pink because I'm so sensitive. Everyone loves this mask, and I get it now.
Yeah.
After the microneedling.
Yes, you need it, right?
You need it. Your skin is craving it.
Right, ready?
Yeah.
Nice and cool. So it comes in 2 parts, covering the face and your neck, and not many. We're going to use the cooling tool to cool and calm the skin after we've done the microneedling.
This is amazing. The skin is craving the coolness.
After all that, right?
You just want to seal in the actives.
There's no chance of PIH. There's no chance of hurting the skin at all.
Guys, you don't wear aftercare that like this night, the night of the facial. You do nothing, you just start the following day. And I'll show you what my skin looks like, so nothing's a surprise.
Okay. All right, so I'm doing the humidifier now. And you can see the beautiful droplets of water sitting on the skin, super hydrating your skin.
It's so nice.
And because of all of that, the pinkness is almost gone.
Wow.
Yeah.
I'm surprised because I have such hyperreactive skin.
Now we're using our beautiful Cera, ceramides and peptides all in one, plus moisture onto the skin. This is like an ad for M&S. Now we're using the InZincable, the lovely mineral-based sunscreen. It's not just a sunblock. It's not just the sunscreen. You get more, and there's no white cast. You're not going to be left looking like Casper at all. You are all done. You're being glowfied.
We did it! That was so good!
Morning, everyone. So this is what my skin looks like the next day. I've just woken up. I've literally not even done my face yet, but I just want to show you my neck. So you remember yesterday my neck was looking really pink, and now it's basically all gone. There's no pinkness on my face. Yeah, skin feels a little bit tight because yesterday, remember, I didn't put any moisturizer on at night time. I came straight back from getting the facial done. You do nothing that night. The next morning, really, your skin should pretty much be back to normal. And now I'm going to do the skincare routine. So the skincare routine is I'm going for the uneven tone, the hyperpigmentation kit. So for me, it's my Cera gel wash first, then it's going to be the Cera Pep Brightening Moisturiser, then the InZincable. So 3 really easy steps. Then at night time, it's in my Cera gel wash. It's your facial hyperpigmentation kit. So there are 2 products in there. It's the HPC Clear and the Vita Ace. The HPC Clear is twice the size of Vita Ace because it's 2 nights HPC Clear, 1 night Vita Ace. And then you lock it all in with the Cera Pep Brightening Moisturiser. And then I'm going to go back in for treatment 6 weeks from now. So what I tend to recommend is you guys do your treatment every 6 weeks for 3 sessions to get the best results. I've just done my skincare routine and my skin feels incredible. Like, I feel like it's more plump. I feel like my fine lines around my mouth area have improved already. So if some of you are curious about where to go and get your facial done, we have something called the store locator on the website. So if you go down to Skincare by Dr. Sophie and you have a look under Glow Facial, there are 2 tabs. One are for practitioners, one are for clients. Go and check out the clients tab, and at the bottom of that it tells you all about the treatment. Lots of videos of different people using the treatment. Yesterday we had a lot of press and influencers do the treatment, so you're going to see all their vlogs. And then you can have a look at something called store locator. So it literally will tell you where the local places are to go and get your facial done, and everyone's been trained by us using the exact same protocol, and that list keeps growing. So we only launched about 2 weeks ago, and we're on 5 clinics, and we've got another 20 that are training at the moment, and every day we're getting more and more people applying, clinics applying to have the facial around the world. This is such a blessing. So I'm focusing initially on the UK and the US, and then we will expand. But we are expanding quite quickly, and can't believe it's all happening. Write down any questions you guys have about the facial, and I will do my best to answer as many as possible. Thank you guys. Take care. Bye.